Oh, gee. Okay, welcome. Okay. Ready for guys? What do you have here? Oh, image? Old school. Oh, cool. This is where it all started. This is a great grandfather Vaughn. I looked him up. Apparently, this is a family tradition. Hey. Mr. Schroeder, yes, I'm going to look at this. Old you look like? Yeah. Even older, even more mature and debonair. You already are.
I get that a lot.
She's just like, oh, I don't know. Mother.
Exciting.
This is exciting. This is kind of new. Kind of? Kind of, yeah.
Just a little.
It's called
No, just a little.
Great.
Yeah, I know. What? Wait, okay. Right here. Yes. Right here in the middle.
Or Jaguars.
Sit there. I have a long lens.
Yeah.
Megan.
Just replace me.
Oh, yeah. I can't turn around and it's well, no, but she's just
Now one.
She's so excited.
I did tell them this is self-regulated.
I'm
Yeah. It's
excited.
too yeah. Workout water. It makes you know those drummers that
Oh yeah, I heard. Megan. Look at your back. I might have put it. Yeah. So you see my reaction while I see you with your clothes. Yeah.
it's live. It's a live feed. So we're gonna actually see Yes!
Yay!
We in this concert just from because you guys are both in this class. But you're in. Yes, it's great. Yeah, actually, you're both in. That's good. You're your book too, right? You're your book too. Okay.
Oh my! I'm so happy. Like, so happy. I was laughing. Oh my God. Bye, everybody. Again. Oh my God.
You must switch over.
I have like
Yeah, that's a problem.
Yeah.
It's really like kind of close.
Where from?
So is that when you're going to?
It's already on.
It's on now.
So we're actually streaming here too, so we get class. You good?
I'm good. I'm good.
Are you excited?
I'm totally excited. Some of you may go to the bathroom. There's a buzz in the room.
Oh yeah.
A buzz in the air. So.
This is gonna be a long one. Make sure you're
This is so cool. Move this up towards the front. If I just bring this screen.
Yeah, I'm not going to change every aspect of myself. Who's you? Yeah, no, do it.
That's live now.
Okay.
Let
Let me start saying.
You can just say welcome. We're live on the air. That's the camera in the back.
Or I can say other things. No, no.
Introduce yourself. Pitch the whole messenger. No.
What's the count right now as far as years? The count? Oh, okay, so we'd like to see that grow. If you guys could. Oh, Brazil, we have an international audience for this. That's pretty cool. We're going to go ahead and ask you guys to swipe right and share with anybody that would be interested in watching a medical procedure in a high school classroom. If that's of interest to you guys, we're pretty excited about it here. We're having the local newspapers having covered it. The district administration, the high school administration are both attending. Something we have a vice principal in the back of the room already. Any other comments or questions coming up? You guys, this is your chance to have my undivided attention because I'm going to give the students priority once the procedure actually starts. So if you guys have questions about how we're doing this, or the procedure, or what it is, because we haven't really taken a chance to dive into that yet. Mr. Schroeder will be, he's coming in right now. Mr. Schroeder will be kind of running quite a bit of the introduction here pretty soon.
You missed, I missed you on scope.
Sorry, Holly. I know that I have not been doing the scopes as often. You're always there every time that we do them. I appreciate you doing that. And when you share it with your friends and give us hearts. Again, I apologize for not doing it as regular as we used to. I'll give you guys a little update as to why that is. It's because we have a new computer system, and we also have, well, I'll go ahead and tell you guys now, we're going to move to a bigger facility. And so that's taken up a lot of our time in the office. We have to get another provider to help with all the patients.
Why did you choose topical instead of injecting?
Oh, we're doing both. Because I don't want to feel the shot. Because I don't like pain. Which I think is good for the doctor because when I treat, I do it the way I would want to be treated. And that's what
I don't remember, just sit down.
What's
It's the speaker. Can I trade seats? No.
that's why I.
She's in charge of speaking.
I have to take pictures for you. I cry. I'm sorry.
Needles, infused injection, injecting slowly. These are all measures that we take.
I'm gonna sit here. Yeah, this is the spot. I think the listener will be like.
Since we're already on embarrassment.
Oh, that was awesome. That reminds me of high school all over again.
Alyssa probably she'll probably want
It's going to be an incision.
Yeah, she said
a simple incision. Ellipsoidal, and I'll show you guys what they do. So, this is kind of a cyst, roughly symmetrical round. And the incision is going to follow this kind of pattern. Something like that. The reason is so that when you bring it together, actually that's a bad one. I don't like that. So that when you bring the sides together and put the stitches in it, it's going to make a nice straight wound without gaps. So we'll try and some people's so with this, it's going to come together nicely. Take this out along with this. And the reason we do this instead of just stabbing it with a needle and
Because I'm going to get right
all the
here.
stuff squirt out like you would with oils, is because this type of cyst, the
Probably
capsule
not.
continues.
Yeah, we just have one back there, and then Courtney just like roams.
Get it out as a
Like if
whole.
she just goes over here.
All right, let's grab a seat. Let's get.
I can get the actual thing.
So then it's a waste
Okay.
of blood. So Dr.
Courtney's gonna run.
who's very skilled.
Haley.
Where's it located? Oh, here it is. Left neck.
We missed one today.
Melissa.
Looking at some of the t-shirts that the students have
Emma's not here
being
today.
very high
Melissa.
Melissa's not here.
They're going hunting for bear for bruins. Because I'm going to bear high school. No, he's over here now. Yeah. So still waiting for arrival of our sterile drapes, but that's okay because Mr. Schroeder is going to do an introduction. Yeah, and do cover Mr. Schroeder as he talks. Looks like you have classes here too. He wants his well, when he gets here. Any more comments or questions?
Somebody just said.
I hope so. I hope it's inspiring for them.
No,
Yeah. Like me.
wearing a tie was a bad choice today.
That's part of the transformation. Out in the
All right, let's
patient.
get this on the road. They've been kind of looking forward to.
That's why you wear your red shirt. What do you mean by red shirt? Okay, sure. I can just do a joke.
Courtney.
Questions or comments?
Somebody just said, haha.
Oh, they know the joke. They know the fire joke.
Probably. Yeah, it's a good job. Good
All right.
job. Good job.
Oh, you might want
Hey,
to.
I want to say a big welcome to the day we've been kind of looking forward to. At least I have. I know you guys have been too. And before we get rolling, I want to say, let me just introduce who we have here. We've got Dr. Mark Vaughn, Dr. Gawain Vaughn. We have Jessica Moreno, who's is medical assistant. And we have Pauline Monroe, there's the nurse.
She's waiting for the sterile drape.
So she's taking care of this.
Yeah.
So I want to just thank them first of all for coming. And also we have in the back of Mr. Greg Ramseth, who's working at the district, and he's going to be filming this. Of course, you guys know Mr. Caminiti, VP, and we also have from the Auburn Journal, Miss Tricia. So, and a quick note, just Mr. Kim reminded me to mention that we can't do any filming of what's going on here on your cell phones. If you want to see what's going on, his Twitter feed is public, right?
Yeah, it's at Dr. Vaughn.
At Dr. Vaughn, so you're going to be able to see this if you want to show your
On
folks.
YouTube as well.
You will
I
not
think
be
it
on
should be.
video because since being minors, they can't show you guys.
Yeah.
But you'll probably hear your voices and all that sort of thing. So, before we get underway, I just want to first of all say how really grateful I am that the whole team is here. Dr. Vaughn and I have known each other for a number of years and taught all his kids, all four of them.
And me.
And Dwayne, yes. And so it's just been a real rich tradition of, after once they started coming up with this idea to have him interact with our class. We did most of the time in FaceTime. Now we're doing something a little more historical. I don't know that this is, I don't know how this has been done. Has it been done in the high school before?
Not to my knowledge.
Yeah.
High school?
And the tradition, I threw this up here just because it's kind of a goofy picture, but this was a very strong tradition of having an operating, used to call it an operating theater. In fact, I still think they do call it an operating theater.
Yes.
Where people would be, students would be there, you're watching, you're observing, this poor guy is being subjected to this surgery, but it's used as a teaching tool, and it's an important tradition. We still do it in teaching hospitals, a little more further removed. And now, Dr. Vaughn is.
We've never seen an operating theater in our medical schools that we've been around.
I guess I was thinking of Grey's Anatomy.
But they do have, I think there are schools in the United States.
Yeah, there are some. I'm
that
sure
have
there
them,
are.
just not.
Well, I looked at that and they said they still do that. So it's
Yeah.
not a strong tradition.
Now, I will say that I have been in an operating room that was open for viewing, for the family members to watch the whole thing. It was in Papua New Guinea. The Nazarene Hospital in Papua New Guinea actually has a huge picture window in the operating room, and the family members watch the patient get the operation. It's a little nerve-wracking the first time you're in a setting like that with people behind you watching.
I think this is probably fallen out of favor because they actually involve us in surgeries when we're in medical school. We actually are there with our hands sterile.
Volunteer?
Inside.
Yeah, instead of it
And
being
people do pass out.
instead of being one procedure for
Everyone.
100 people watching, you're right there,
And you're
front
going.
row,
Mhm.
handing instruments or hold this,
Holding stuff.
put your finger on that until it stops bleeding, sort of thing.
And what we're going to be doing today is really, it's got a dual purpose, is to see something really cool. Because we don't normally get to see something like this. But it is really about teaching too. And they're really bringing this whole, how do you set up a sterile field? How do you do a procedure? What all is involved in that? To enable us to be able to see that. But it also means if you guys have questions, I assume you want them to ask.
Absolutely.
Okay?
And even though we also have questions coming from Periscope, you guys get priority on the questions.
So anything you look at, it is going to be broadcast here in just a moment. In fact, I'm going to put it on there right now. It is going to be broadcast on his Twitter feed. So you're going to get to see it.
Periscope.
Or Periscope. You're going to get to see it live.
There we are. So it's a little delayed. And you'll be able to see the comments as they come up.
Little bit.
So.
So anyway, but yeah, feel free to do that if you have questions, and that way you're gonna get to see his cyst magnified to about the size
Right.
of basketball.
So if you hear me yell, "Oh my goodness," wait like a minute.
Yeah. Yeah. What are the hearts?
Okay, Periscope is, there's people watching us right now, and if they like what they're seeing, they tap the screen, and it makes these hearts, and it actually tracks how many hearts you get. So you know who's really hot on Periscope because it lists them by the number of hearts. So if you have 25 million hearts, you're really popular. Or it's probably more than that now.
Are we going viral? Are we going
Have we yet? I think
I
we
would
have
prefer
15
no
people
viral.
watching. 15. Oh, here we go. See, hi to the students from New York City. That's Empire City Ray. Hi, Empire City Ray.
Hey, all right.
So it's more than just the classroom.
Hey, look at that.
Yeah.
Well, let's give a big hand just for coming. And with that, I'll turn it over to them. You guys go ahead and do your.
Do what we do. Well, first we'd like an update on where the sterile drapes are.
Oh, so.
Let's see, our car is still there.
So you're not quite ready to go?
Well, we can actually do a few things here while we're waiting. We forgot the sterile drapes, and I think that's the biggest thing you guys were worried about, us keeping this sterile. So those are important. So what we'll do is actually draw up and numb up Dr. Vaughn here while we're waiting for that. We can do that without a sterile field because that's very, very local and just a needle. So I'll get all that stuff again and get that going.
And then now, Kara, how are you and going related? You guys are second. First cousins.
Yeah.
First cousins. Yeah, it's your own. I mean, that's his.
The red
Yes, I'm not broadcasting sound because it's 3 second delay.
You can bring that video over here. So, I'll let you change while I,
blah, blah, blah.
So he's decided to go the full, from beginning to end.
full
as a
Monty?
patient.
What?
Pardon?
The full Monty?
No, I didn't say that. But he was gonna.
I don't think they signed that.
From beginning to end, but, being a patient forward. What becomes the patient?
So,
Oh, you remember this?
Oh, yes.
hey, I got one.
That was 2013.
So we have a couple medications here. These are used for the numbing. Lidocaine with epinephrine. This is lidocaine. I'm sure you've all heard of that one. It's a numbing medication. It has epinephrine in it. Epinephrine's very important. Epinephrine will cause vessels to constrict. So if we inject that in there, the vessels around the area will constrict and less bleeding. And it actually makes the lidocaine work a little better too. The other thing I have in my hand here is called sodium bicarbonate. It is a buffer. You guys know all about buffers, right? So epinephrine is actually pretty acidic, and if you inject it straight, it can be quite painful and burning.
And what are you doing right there?
So we put a little bicarbonate. So we got to clean these off before we stick the needle in there. So I've got a little alcohol swab. I'm just cleaning it off.
Do you want to do any prep before you enjoy it?
Yep. I'll just use alcohol.
And just the table itself, is there any issue on that? Or is that what
Not right now.
it's gonna be for?
Eventually, we'll have you up here.
So,
You can take it.
so we'll draw that up.
27, really?
You win.
Is the number
You're moving
the,
stuff.
size
You're
of-
moving stuff.
Sure we could have gone with a 30? No, he actually is using the 27.
Are you really?
Yes, he is.
By the way, have you guys done surgeries on
On each other?
No.
All the time.
That's a good question.
That's fun.
Yeah.
And now he's a patient.
You took my cap.
I gotta take your cap.
You took my cap.
Oh,
Suddenly
that's a
everything
shark.
went.
Don't do this at home.
I can reach in the trash and get it for you.
That's all right.
Okay.
So there's a couple areas on the body we do not use epinephrine. Dr. Markon, would you mind elucidating the students on the nice little rhyme we use to remember those? We can say it. It's a high school class.
It's a high school class. These are Have you ever said it in front of your daughter?
You taught me what?
Have you said it in front of your daughter? Uh-oh.
They taught it at your medical school. My medical school didn't have that.
Oh, well, the acronym, I'm not scared saying stuff, is finger, nose, penis, toes. All right? So there are a few places you don't want to use epinephrine because if you, well, in theory, if you decrease the size of those vessels and you decrease the blood flow to fingers, nose, other areas,
There's only one.
yeah, there's only one supply, right? So they can actually, get necrotic.
Yeah, pretty much everywhere else where you're going to be numbing up the body, there's going to be blood supply coming from all directions.
Yeah, like
So,
a neck.
If you do the tip of the nose, and there's only one place the blood supply is coming from.
They're all distal points.
Yeah, and this stuff can last a long time. Are we getting comments or blah, blah, blah?
Yeah, we're all drawn up.
Can I go ahead and
Hey,
start?
don't leave needles lying around.
Don't leave.
All right.
How do you want me?
That's what she said.
Oh my gosh.
All right, let's see here.
Okay.
Is that
so
pillow
I
good enough
guess
for you? Do you want me to hold it down?
rather-
No, I think
Oh,
actually.
this goes well. Grab the cameras. Anything else?
All right, so. Can we bring it around and that way we can kind of see where what we're dealing with here.
For you.
Everything.
Yeah.
So we can see that there. Everything's delayed, so I'm sorry it'll be a little delayed on what you're seeing here. I'll try to, I guess, lengthen it out. But this is a sebaceous cyst. Had to estimate the size of that. I'd say maybe just under 2 centimeters. And what we want to do is numb up the whole area that we're going to be opening up or potentially cutting into. So we do what's called a field block. A field block is where you just numb up all the areas around an area, and then everything inside that will be numb, up to a certain size. But that's what we do. So essentially, I'm going to create a little diamond that'll be numbed, and he'll jump and squirm, and it'll be fun. So.
And before he does this, I'm going to remind people, if you're not comfortable,
Yeah, if you're not feeling don't stand up.
Self-regulate, please. Turn away a little bit. You don't want to have another operation.
You already know.
Goggles. Are you going to wear goggles, Dr.
Yeah,
G?
I
Or is it any happy price?
Sportage.
By the way,
You guys are worried about that.
Where did you see that? Which Holly? Holly Vaughn? I know, but they spelled her name wrong, so.
But I bet you this.
Are you nervous, doctor?
I'm actually fine without goggles. I have been sprayed before.
Kara, do you have safety glasses?
yeah.
Do you have eye protection?
All right. I guess we don't have goggles. That's all right.
One of your brothers said it will be just fine.
It looks like a cyst of some kind.
Don't make me laugh.
Not quite goggles.
See that?
Oh,
Yeah.
perfect, that's what we have too.
You can sit.
Let me see if I can see it. It's perfect. Let me numb you up and then we'll turn you around. Jeff, before we go on.
Good.
I will. Do you want carrots?
All right. So, little poke.
This is like a flu shot.
Yeah. They're gonna say it's almost done with.
He can give it, but he has a hard time taking it.
Okay.
So some of you don't do needles?
Students, keep an eye on the screen. I'm not worried about him.
Oh, wait,
All right.
By the way, keep in mind, once you get some anesthesia in there, then it's easier to move it around because you
Remember, this is your
don't
idea. Sorry, taking because I'm pushing hard enough.
take it from the teeth.
No, the milk is in the fridge. We didn't even touch it. You did it. Okay, what do you think? Do you want to spin or do you want to
Yeah,
stay?
let's do that.
What are you comfortable with?
Oh, I'm fine with it.
Why are you nervous? Tell me why so. Because
So you're,
because it hurts.
so Mark, do you feel the whole area is numbed, or can you feel that?
I can't tell.
We'll see.
Feels like he has a 17-inch neck now instead of a 14.
Yeah. And now, what kind of incision is it? Going to be a football shape or what?
Yeah, elliptical is the fancy term for that.
Yeah.
Football incision.
Football. Take out a football.
Hey, look, somebody drew a picture. I think you guys may be able to see better if we turn them around and I'm on the other side. Okay, let's do
Should we
that.
turn around?
Does the numbing help? Yes.
Are you able to sit up?
Do you want to sit up? And then somebody said you're doing great.
Yeah. Do you want to just do the table or
him?
Do you want to get up and turn? Or do you
do
want
the
to
table.
just pick you up and turn?
Oh, sure.
We turn table. I mean, I think you're fine.
What was that? Oh,
I
it
hope
was the
you're
chair.
not going to pass out from that. No. Now you can't see yourself.
That's okay.
Maybe that's.
I can see these guys.
Hey, there we go.
All right. I'm going back.
That's the plan all I like this so much better than seeing it.
You'll be able to watch it later.
back.
Officer Trooper. You're getting props from somebody else.
Were there lots of parts?
So we'll want to. All right, so we've done our numbing now. Now we've got to produce our sterile field. That's the most important part of this whole procedure because we don't want to introduce any infection. So you can watch Polly; she's an expert at this. Been doing it for years.
4 years of college and 30 years.
30 years.
Almost.
So as you can see, she's not going to touch anything. Everything that goes on this blue drape now is not going to be touched at all. And there's also going to be a drape that goes over him, and everything that's blue is sterile. So we don't touch that.
Your tips are sterile?
As you put on sterile gloves before this goes on. So very important step. And then before we do any opening and sizing, anything like that, we'll make sure he's nice and numb before we do anything.
Are these done through an autoclave or what?
Yeah, so that's how we clean things with an autoclave. Something.
Giant pressure cooker, basically.
Yeah, it just gets really hot. It kills anything that would be alive. These did not go through an autoclave. These are sterile gloves, pre-packaged.
Yours, your iPad?
We did bring some sterile gloves that probably would be your size, Dr.
Mr.
Need
Schroeder.
my assistance?
Everybody's
We
got it.
need to see
So-
if your hand is the size of my hand or the size of Wayne's hand.
Look at that.
Let's wear the 7.
Let's wear the 7. So once we kind of get in there, we'll one of the things, if you want to watch me put on my gloves, then you can put them on sterile because there's a very proper technique in putting on gloves.
So you're saying what now?
Just watch me put mine.
Okay, got
I'll
it.
watch
Yes, I
you.
will do that.
And then don't pick your nose after you put them on.
Too much.
Missed. All right.
Any allergies to any medications that I don't know about?
Not that I know of.
So now we're putting on a little betadine. We always ask if somebody's allergic because unfortunately iodine is a big allergy.
People are allergic to iodine.
Yeah. Topically. And we do this 3 times to be triple sure that everything's nice and clean.
Kind of cool on one part there where you start.
Where I start?
One part of it, yeah.
Okay, let me
Let's
go
see.
slow and you tell me.
I'm guessing that it's probably the most. There.
Right there?
No, go back. The most inferior part. There. That area. That feels cool.
Okay.
Is that in the surgical field?
No, I think that'll be fine. I think for outside, I'll test it.
I'm making a big surgical field.
All right.
Big field. Make them look jaundiced. Yeah.
You
Hey, you guys know jaundiced?
got it.
All right. So, I'll need a scalpel.
You know that.
Yes.
Hey, look at that.
Demonstrated already.
Yep, we got there.
You do have redundancy, right?
Touch your
Okay.
All right.
All right.
There's a proper way
Well, yeah, I
to
want you to know.
put on sterile gloves.
Okay.
But just on the skin it doesn't.
So, pulling it out is not a big deal.
I'm not going to actually cut it, am I?
Oh, stain. I thought you said sting.
I'll give the world.
So you open it up.
Yep.
Tells you what size, right, left.
Okay, good.
So you can come over here and tell how to put on sterile gloves. So exciting.
I'll still be here when you get back.
Okay,
All
don't
right.
go anywhere. So
Oh, yeah, look at that.
this side's sterile. Everything on the inside.
What happens
right,
to the
not
people who
sterile.
are allergic to
Inside there.
iodine?
Got it.
So
we use something else.
Grab it. Touch the inside. Open it up.
What's the name of that?
Grab.
Ibiclins.
Inside is sterile.
Inside is sterile.
Outside is not sterile.
Got
Okay, so you can touch this, which
All
is going
that.
to be on the inside, but don't touch anything else.
it. Okay, so you have to grab it.
Grab.
So if you hit the wrong hole, you're in trouble.
Yep.
Yes. You gotta do
Now,
that.
inside is
Outside
sterile,
sterile.
right? Outside not sterile, so I can grab it there. This is still all sterile?
Right. The whole thing. Got
Yeah. So, fingers are on the sterile side.
it. Yes.
All right. Good.
But you want me to?
Now, I can't touch anything that's not blue. Well, not even that. Anything that hasn't been thrown. So. we use cool terms like thrown. It's just kind of like throwing things. This is called the
And you are
fenestrated
now
drip.
entering the sterile field, and that's okay.
Gonna create a sterile field also.
Yeah.
And somebody keep an eye on
Oh.
Mr. Schroeder's hands, make sure he doesn't touch it.
And what this does, it's a nice sterile field around it, and can you see anything? You okay there? Not.
I see all the students.
Okay, good.
If I open the door, would that give you better light?
Man, we didn't get the light on.
Do you want light?
Maybe, yeah, that makes it better.
I can use my iPhone flashlight, that might be.
No.
Yeah,
We'll keep you
I
off
think
the,
we'll be all right.
All right. I am just the videographer.
All right.
Yeah.
So,
Focus.
let's talk a little bit about the neck. Have you guys studied the neck as far as anatomy? Do you know every structure in the neck if I quiz you? Man. The neck's actually very complicated. Okay, everything from about here up, lots of stuff going on. And when we do like physical exams, if you've ever been to the doctor, we spend like half the time just from the neck up. So, he's got a light there, maybe. You just can't be like directly over it. It's like up over there. Hey,
Are you doing okay?
Mr. Schroeder.
Don't trip on the floor. I will not trip.
So I've got some. I don't know if you can see that.
Yes.
Some tooth forceps. These have a nice sharp tooth on them. So with these, we are going to check to make sure he is numb in the area I plan on cutting. Feel that?
Yeah.
Feel that? Now you were having a little out here. I'm going to go a little farther. Get there.
Barely. Just barely.
Out here.
Yeah.
Okay. Good. So now I know my boundaries. So sometimes we'll draw or do freehand, or sometimes just cut. So that's what we're going to do.
So you're going to do it horizontally along the Langer's lines?
So yeah, let's talk a little bit about Langer lines. You guys know what Langer lines are?
No.
So in the 19th century, this guy named Langer, probably Hans or something. He's a doctor.
Maybe doctor.
He discovered that there was these things on the bodies called Langer lines. It was kind of a cool way that he discovered it too. He had corpses, went in and he actually poked holes in them all over the body, poked holes. And then he found that over time, if he came back to these holes that were perfectly round would turn into ovals. And then he'd kind of draw this, and he found that there are these lines along the body. And when we're doing surgeries or procedures, we want to cut along those lines because they heal much quicker, and the tension is less. So where do you think we should cut here, I guess, is the question. Should we go this way?
Well, you can see it with the natural wrinkles on the body.
Yeah, older people have wrinkles, which make it really So obviously you can see his, which are, I don't know if you come up here and see, they're right along the, where we're going to cut. So we're going to go right along those lines to make sure that this heals.
Just like fabric.
Just like fabric. Actually, almost like fabric. All
Or
right,
steak.
so we'll make our
So
incision.
parallel to the.
So let's start cutting.
Screen, you good back up?
Yes.
There we go. Feel that?
So,
Feel what? That's good.
Those are really sharp.
So these.
So did you?
Something feels sharp. So what I'm doing is just kind of opening up the skin, getting down to that cyst. I'll do it on both sides here so we can free it up. Thank you.
Mark, you gonna get
Just
her?
a little.
what?
Just a little nervous.
Who is?
Me, I've got an audience. Here we go. I think that'll free up.
What was Mr. Schroeder saying?
Let's make sure you're okay.
Are you okay?
Yeah, I'm fine.
You can't feel any of that?
So the
I feel when he pushes on me.
good. You should feel pressure.
Oh, gosh. Somebody said
And
You
stop
guys-
cutting meat.
Are you surprised about that?
It's like so gross.
He shouldn't be down to the
It's
meat.
pretty healthy.
LOL.
LOL. Really?
Who's saying LOL?
LOL. Really?
Let's
That
remind everybody.
borders on
it's a
inappropriate.
High school class, so just
Who's
remember
saying
that.
something?
Oh, yeah, you're asking, this is hard or
Remind
soft?
everybody who's watching
let's not
live,
say
just
any-
so hard or soft.
So Gwen, is it hard or soft?
Tartar sauce?
Actually, that's
It might be.
not a bad description of what's inside. So what we want to do is try to remove it in its entirety, and then once we remove it completely, then we can maybe see what's inside of it.
Oh, that'd be cool.
Very classic material in them.
Yeah,
It's almost like cottage cheese. I don't know if you guys have eaten lunch yet. Hard or soft is kind of a tough way because it's firm, but it's compressible. So it's not super hard, but not soft and squishy.
It's not like carrots.
The material in it is skin oil.
Yep.
But when a duct gets blocked and this material can't get out, it becomes a semi-solid.
Yep.
White in color.
Yeah, we'll show you. Well, we will show you what that looks like. Hopefully after the procedure. So the true measure of a person who does this procedure is whether or not they can get it out intact. So I'm going to say that up front.
Pressure
And
on.
Yeah, not to put the pressure
pressure
on.
is all there now. So now what I'm using are some scissors. And actually what I'm going to do is what's called blunt dissection. So we're going to tear the tissue along its natural plane. So I kind of poke in and then open up, and the tissue just kind of tears apart where it normally would. So that's what we're going to do.
So the question is, it's like fat.
Is it like that? No, not at all like that.
How did you know it was sebaceous before you saw it?
They've got a very classic appearance.
Yeah.
And that's
They're common.
very common in the face, neck.
And the way you tell
Torso.
it from a lipoma, which is very similar, but is a collection of fat with a capsule around it. The sebaceous cyst, if you kind of move the skin around, you can tell it's in the skin, whereas lipoma is under the skin. You can
Okay.
move the skin around over it.
We don't need that. Let's just.
That makes sense.
Hey, we just opened it up a little sauce. Now we know what.
Don't get it in.
Oh, I know.
Don't leave any behind.
Oh, Empire City Ray.
Empire City Ray.
That's got some New York. Right?
Yes.
There we go.
Oh.
Cool.
Yeah.
So, let's see, what else can we talk about? Let's talk about the posterior neck. The neck is divided into triangles. The posterior neck, it has a posterior triangle, and that triangle is composed of 3 sides. Wait, you guys know that. So those 3 sides, anteriorly is the sternocleidomastoid, which is that nice bit. Oh, you guys know what sternocleidomastoid? All right. Hey, you're doing a good job. Mr. Schroeder, doing a good job. So we're going to do this with a blunt dissection here as we go around it. On the bottom by the middle third of the clavicle, and then on the back by the trapezius. And inside this are a few key structures that you would want to avoid. One of those being the subclavian artery, but that's pretty low. It's not anywhere where we're working. There are a fair amount of nerves, the main one being the spinal accessory nerve, which is the cranial nerve number 11. Did you guys learn about that one?
We'll get into that.
Ah, sweet. So you'll learn about that one, which has a few cool functions, like saying, huh? That's one. And then the subclavian vein. And then the bottom of it, there are 5 muscles. Do you remember what those muscles are? I'm going to try to remember those. The scalenes, middle, anterior, posterior scalene, the levator scapulae, yeah, and the spontaneous catheter. So,
Somebody should be looking this up.
yeah, somebody be confirming this. I could say whatever I want. Because that dude's smart.
That's what Periscope's all about.
Make it up as you go. The surgery, that's what I'm doing too, just making it up as I go. I'm gonna start to get a little more aggressive as we.
Yeah, everything's.
He's probably feeling the pulling, and then the thing you do is you try to get right up next to the cyst, and once you do that, once you get a plane going, it starts to show itself, and then once you get there, that's when it starts to go more quickly. So that's what I'm trying to do, try and find that plane. There it is.
So I'm gonna ask these guys here, since we're in the sebaceous gland, what layer of the skin are we at?
The dermis, right? It's just, it's a dermis, yeah.
Let's say we're talking about lipoma. Lipoma would be a hypodermis.
Right.
So,
That's how you tell, yeah, it moves or it doesn't.
Okay, that's sorry.
So,
That's all right.
is there any concern for like small nerves? Wayne, are there any concerns?
So anytime you go in, you are hitting small nerves, yes.
Sorry, Dr. G.
There's not a lot of.
How do you know you've got it all out? Higher uric acid.
We'll talk about that when we get to it, but you kind of see all of the contents. That's why I say getting it out in one piece is ideal, because then you can see, hey, I got all of it. Because you see the huge cyst sitting there on the table. If it breaks up, then it's a little more difficult. All right.
What are we going to take off of my body when Lisa's in this class?
You
I'm gonna throw another one.
probably need to start growing something out.
Start.
Let's do a toenail. Toenails are
Oh man, that would make sense.
toenails.
Let's see. What else are we talking about? Oh, we can talk about nerves. There are different types of nerves. Do you guys know the different types of nerves?
No.
A little bit. So what do you guys know about nerves?
Nothing.
How about this? How about the fact that he said, I feel no pain, but I can feel pressure. So you can feel something, right? So what does that tell you about nerves?
There are pain nerves and there are pressure nerves.
Yeah. Very good. Yeah, so there's different nerves in the body that convey different sensations. And lidocaine only numbs up the pain nerves, which is kind of nice. So he's still feeling all this nice tugging,
Yeah.
but no pain.
Interesting. So does it bind to the receptor to block it, or what? So lidocaine, the receptors are just different.
I think lidocaine works the same on all of them. I think
It
it's
does
just
work
that.
well. It's just better.
I think it's just that the pain is so localized, whereas the pressure is more of a broad area.
Okay.
Well, pain goes through the small nerves, so they're smaller. They're literally smaller.
How long does lidocaine last?
About 5-10 minutes.
About 30 more seconds.
4 to 6 hours usually.
Figure it out.
4 to 6 hours.
He's sewing.
No,
Sewing. The scissors working okay?
no, they're not.
Want another pair?
Can we try the other ones?
Bet.
This is very hard when you have adult pairs of scissors. They're supposed to be new.
Ready?
Did we get new ones?
We
Yeah.
did get new ones. These are the new ones.
I'm not sure, they all look the same in a package.
Okay, now you can't drop anything.
Did we get them through Gary?
What?
Did we get them through Gary?
Yeah.
That's not. Okay.
There we go.
Skin, but tough neck. You joined late. What are you working on?
Joined late.
Yeah.
Somebody's just now coming to
And
the
then
party.
some optometry has joined us.
Oh,
He wants
doctor
to know-
of optometry. This is an eye, as you can see.
Join late.
An optometrist is watching.
NSU optometry.
Really? Well, welcome to the Periscope.
You guys have any questions? Anything, anything you want to
In
ask?
front of a high school anatomy physiology class.
Oh, you can't, yeah. This is gonna be saved online, right? They could actually see this.
Yeah, we'll put it on the Auburn Medical Group YouTube channel.
Medical group on Twitter.
YouTube.
On YouTube.
Probably also put it on AskDrVon.com.
Are you feeling comfortable?
My neck's tired of being flexed to the right.
We're happy to answer any eye questions. That's not an eye.
Happy to answer any
Yeah, if the patients have eye questions.
Let's make it more interesting. Wow.
What do they want, blood?
I
more interesting.
don't know how to make it more interesting.
Not that I would want. No.
Yeah, nothing that would end well. Yeah, there we go.
Okay, you got it?
Yeah, now we're starting. Yeah, yeah.
So, Wayne, is as big as you thought, or is it?
Oh, they always go down deep, which is fun to deal with. There we go.
They kind of recess themselves down in
Okay,
there.
so a little lower.
Yeah.
Next.
Okay, so removing an egg sac that implanted itself in your neck.
Nice.
Yeah. See, all right, take a look at that. You can get that on there.
Yeah.
See that now I'm right up against it. Now things will start moving a lot nicer.
Is it okay for me to be this close? As long as I don't drop it?
As long as I don't
Maybe
drop the
back up,
light.
maybe.
Okay.
How does it form in the first place?
A duct got blocked. The oil normally comes through from the gland, and the gland just keeps producing it. Shouldn't, but it does.
That's funny.
No, there's the alien.
There it is.
Nice sense of humor.
It's kind of cool when you can like deliver it where you pop it out.
Yeah.
Deliver the alien.
Yeah, the alien. Yeah.
Lay it on the mother's
Exactly.
abdomen.
Have some time for bonding, you know.
Skin to skin.
And, Wayne, are you actually removing the whole gland, or is it just part of the duct, or what's?
But you want to get all of it, or this is going to come back.
Okay, so the whole gland, this is basically a affected gland.
Yeah, it plugged and it still keeps producing, so it just
Yeah,
collects.
these glands are normally microscopic, but this one got big.
Yay.
Remember, you guys each hair has its own little sebaceous gland, so. Very big.
Has it been getting bigger, or is it just, do you just reach one?
It grew over, I don't know,
Well, it's been over a year.
a few months,
We know, because you
and then at one point it ruptured in the skin.
Oh, wow.
It never came out. And so it got red and hot and swollen, and it was very painful. And I left it alone, and eventually it sealed off again, and all the inflammation went away. And here it is, years later after that we're finally getting rid of it.
What are some of the dangers if you don't do anything about it?
None.
No.
It could rupture again and just be
Ruptures, get
painful.
inflamed.
Yeah. So when patients come to me with these, I tell them, hey, look, I got this thing on my neck. I don't do anything about it.
Now you don't have them.
Now I can't do that
You
anymore.
don't have an object lesson.
Just look ugly.
You can just be like, it was for fun. I did it for fun.
How would you know if it's
So, I once did one of these procedures. That brings up a good point. I once did one of these procedures, and it was on a guy's arm, and it from the outside, the look of it, it looked just like a sebaceous cyst. So I got in there and started to remove it, but it didn't have the normal sac. It was just kind of weird. It was just weird. These have a very typical appearance. So this guy, I said, this is weird. I've got to look at this further. So I sent it into a pathologist who looked at it under a microscope. Turns out it was metastatic lung cancer.
Oh my goodness.
Yeah, they have a very classic appearance. This one does. You can see the nice sac there. That's how we know what it is. And they have a very typical course too. Kind of they pop up and hang out there, get inflamed.
So does this feel different when you examined it?
No.
Did the guy not know he had lung cancer? Or?
No. No, we found it in his arm, and then later did a CAT scan of the chest and found it.
That's not.
Are you worried about your dad, Carol?
And again, it's still surprising that there's that little bleed. So the epinephrine really does.
I'm talking about ice.
Yeah, I expected a lot more blood.
Or
Okay, explain why there's not so much blood. Did you do that?
Yep,
Oh.
epinephrine.
We said epinephrine.
So we're getting around it. It's coming. How long is your class?
Give it 25 minutes.
Oh, okay.
And so we were talking, wow, that's quite the extent.
There we go. You can see that as I find these planes, it just starts to open up and free up. It's really, really nice.
So how many of these have you done?
How many of
Like,
A number. Zero is a number, right?
Yeah.
Probably 100 or more. When I was working up in Reading at a community clinic, they didn't have a procedures guy, so I got to do all the procedures, which was kind of cool. So I got to do all these things. So once a week, I just had a full day of doing these. And that was fun. And vasectomies. I do those too. You guys are too young.
I mean,
Reversal?
Oh, we're getting up under it.
yay. All right. There it comes almost.
That looks, I just got free of these. Side here a little more.
That is like an egg.
It's like,
It's like an egg.
You guys are not very squeamish, are you?
It's about the size of an
You guys
ovary.
can watch.
So it's pretty good
Postmenopause.
size, but
We're gonna be dissecting fetal pigs, so
Right.
we have to kind of be okay.
Yeah.
This
They
is
don't
way
bleed.
better
Is there
than
going to be a
fetal
quiz
pigs.
on this?
Because fetal pigs just stink.
Fetal pigs. Yeah.
They stink.
It's cool though.
It is.
It's not as cool as a
I'm so
cadaver.
excited.
yeah, cadavers are cool. Until they move,
Till then.
then they're scary. But they run slowly.
Will we have an empty space there, or will it fill?
That is a question. I guess,
That's what Mr. Schroeder's sterile gloves are for.
what are we going to do when we get it all out, huh?
Put a marble in there, just so you would.
Yeah, put a marble in there, like kind of like a glass eye.
Is that the optometrist, Gus?
No, it's the guy from New York. Oh, sorry.
Empire City Ray?
Empire City Ray.
He wants
Our
to
favorite
know
followers.
if it's gonna be empty.
It's coming.
Actually, it's stuck out from the skin, so it's gonna be
That's
pretty.
good.
I'll probably throw some deep sutures though. So usually what we do to close up that area where it usually is throw some deep stitches in there just to bring the tissue together so it doesn't fill up with.
Oh, is this the time to get Mr. Schroeder's finger?
No, it's
Not
not
yet.
quite out. It's getting there.
Okay.
Oh,
I am-
don't have my gloves on
No, not yet.
yet. Okay.
I'll tell you when.
Mr. Schroeder!
He was always like, oh my goodness, it's something I did a minute ago.
Yeah, it's kind
What do I do? What
of
did I do?
odd watching the delay.
What did I do?
This will be interesting when people are standing.
Well, it's out of the pocket. a little
Yeah.
bit, So it's like laying on its.
Probably take a little more time doing these.
Maybe it might be time to order new scissors.
Maybe. I thought you were going to say pizza.
Big deal.
It's time to order some pizza.
Pizza sounds good.
Maybe it's not time. I was just looking at my watch. Looking, time to order pizza.
I bet you somebody on Periscope you do that.
Mushroom. Mushroom. That's cool.
Mushroom.
There it is. Can you get it from this thing at all? So they can see.
That angle?
See, just a second. When you put
Oh,
some
sorry.
morphine up.
Wait, we got a question here.
Do that.
Is a cyst and a boil the same thing?
No, they are
There it
not.
is. Okay.
Well, boil's a
Oh,
kind of
'cause it's
cyst.
right.
So I'm just trying to
Boil seems so.
free it up with
old-fashioned.
my hands.
Still
Your
getting
boil, we
used.
still use that
I
term.
saw a guy.
When you get bit by the MRSA spider.
Oh, yeah.
Versus spider.
So what's the technically defines a boil?
So boil is an abscess. An abscess is a collection of pus without a surrounding sac.
So you just squeeze those out then?
Yeah, we just open it up, and that's actually the definitive treatment. If you have a collection of pus in your skin,
Get it out.
you got to get it out, or else it's going to eventually get into your system, and you're going to get septic, which means in your blood.
So boil an abscess, it was saying.
Yes.
Okay.
Well, you can have an abscess inside of the body too. Boil would be an abscess in the skin, but you can also have internal abscesses, like on the intestine.
I don't know, I can't handle it.
Mr. E just.
Mr. E left?
Yeah, he's getting some fresh air.
Yeah.
Fresh air.
Can you say pus too much?
Pus.
Pus.
I bet he's getting pizza.
Purulent. Do you know that the medical community has made up its own, no, it's not really made up, but we have our own term for pussy? Because when you write that down, it can be confusing. So we say,
It's hard to know how to spell it.
so we say purulent. That means that it's pussy.
One S.
Like a purulent cat.
We also have a word for that squishy feeling when you push on it and you feel it squish around. Yeah, and the hard feeling when it's not squishing. The squishy feeling is called fluctuance. The hard feeling is called induration.
Induration or?
Induration. So if you have a big red area, hot red, painful area on someone's skin, and it's just firm and you can't feel fluid inside at all, we call it induration, and that's a cellulitis. And if you can feel it kind of squish, then you know there's a collection of pus and there needs to be drained. That's an abscess.
Sometimes it can be hard to tell.
And sometimes you have both. And sometimes it changes from one to the other.
We're getting under it here.
Yeah, I do have a sensation of movement.
Of movement?
So if we were to do something like this in the office, we would block out like an hour.
I just felt that
If we were to
bump
do
inside of
something
me.
like this in the office, how much time would we block out? An
I
hour?
just take more of these 'cause I'm-
What about?
Oh, there we go.
Backside.
Backside.
Almost done, Dr. Mark.
Take your time.
Oh, it's coming. It's like giving birth.
You can chant.
You're almost done, you're almost
We did
done.
go through Lamaster.
Yeah.
No, that was getting numbed up.
That was
Somebody held your hand.
Yes.
all right.
All that fun stuff.
Are you going to let Mr. Schroeder deliver it?
Deliberate.
Did you name it?
Its name is Clarice.
Clarice.
That's what Carol would have been.
Kara, why didn't we name you Clarice?
Oh, I know why. I think I know this.
What?
That's what your real name's name.
Oh, so we had to come up with a different name for the next kid?
You didn't have any on reserve?
I think it's because
I've got
of
plenty on
I thought it was
reserve.
an old
I
girlfriend.
think it's because of the look Grandma made when we said that's the name.
She does that, huh?
What's this, Gary? You were supposed to be Clarice.
Yeah, our son's gonna be named Elias. Elias.
And we have different names for each of the kids too. We didn't carry over any names.
Elias grows on you.
So what would Kara have been if she'd been a boy? What was her name?
I think it was Stuart.
What, Stuart?
No, not Stuart. It was Scott.
Are you talking about
Scott.
the cat now, Chester?
Scott Daniel.
Aw.
Oh.
Oh, there you
Oh
go.
Wow.
Sorry. You want to get your
He's giving, yeah.
gloves on?
And then do we need the,
Okay, I'm gonna drop the light for a
Goes
second.
on, goes on.
we need the.
Drop the mic.
Just watch it.
Polly's
I
good.
do it here now.
Right there.
Yeah.
Get them on, just hold your hands like this and that will help you avoid touching.
Did you want to grab this basket? Eureka!
No pressure.
Wow, you missed it all. What are we watching?
Oh.
You just
Watch it.
missed
Oh,
You just missed
they're gonna have to catch the replay.
Yeah.
Someone just now.
Okay, top 10, here we go.
Okay, don't worry about the fingers because you'll fix those after you get the other one on.
Yep,
This I can go in.
yep, after you get it, and you can pick it up there.
Do you want to drop it, or you want to lay it here? You want to lay it
I'm gonna
out?
have him actually do the last cut. We are having him actually do it.
What?
Yeah, it's a little,
It's trickier.
Let's see.
trying to open it up on the inside, it's a little hard, I know.
Oh, man. I can't touch this one, can I?
Right, you're limited.
Start over. Are you really going to put him inside?
Yeah.
No, he only needs one. He only needs one.
Yeah, we just do one.
We just do one.
All right. I can touch this, right?
Now you can touch.
Now you can get your fingers.
There you go.
Rookie mistake. There we go.
They actually have,
Okay, watch the cord.
okay.
Is this sterile?
Oh, my
Yes,
goodness.
everything is sterile.
And I won't sneeze or anything.
Scissors.
Yes, thank you.
What I'm gonna do is lift it up here. One little area there. We just need to deliver.
I'm not too nervous.
That's my eye.
Oh my god.
Keep your hands out there.
This is pretty great, man.
You wanna stick
Well, fist bump when I can't fist bump.
So,
That's pretty good. Mr. Schroeder, stick his finger in. Stick his finger in.
From this head.
pretty cool. Now you're right.
Oh, you get him putting his finger in there?
You can touch that.
Oh my god.
That was the first. That was the first.
All right.
You just keep your hands
Just
together.
yeah.
What do you want?
One of each. 130 micro, 140.
Good job, Dr. G.
This is a first. Yes. Assist.
So I think somebody asked earlier what we're gonna do with all this open space here, and
Rent it out.
we're just gonna leave it open.
Yeah.
Super glue. We actually use that quite a bit. It's sterile. So because of that, they charge like 10 times as much. All right. So what I'm gonna do is I've got two different sutures here. One of them is Vicryl. Vicryl is actually made of a chain of it's sugars, right? Galactin or something like that. Anyways, it's absorbable. So that we can put deep in the skin and it will absorb over time. The other one is called nylon, and that's what it is. It's nylon. The skin does not like that, and it's got to come out. That's for surface home. So we're going to do a couple deep stitches, I think. Yeah, probably a couple, and then we'll throw in the surface ones. As you can see, this really isn't bleeding that much, which is how these things go. Because we're in the dermal layer, we're not down to veins and arteries and all that stuff that fruits in your face. So veins don't, arteries do. Because of pressure, right?
There you go. But you got some teeny tiny ones, but they're so tiny they probably just clot up. I want to touch it.
There you go.
Oh man.
So we'll
It's like a Super Bowl.
kind of feels like a Super Bowl.
Yeah, no, I don't want to go.
Actually,
But you can put it in your hand and carry it around.
Yeah.
yeah. Show everybody.
Show and tell.
It's,
He's so proud.
I'm like a kid.
He's so proud.
You want to see? Oh, thanks.
So
There are your
cool.
stitches. All right.
Oh, I know.
So when do I have to get the bike over to? Didn't I just explain it? You said that they were absorbable. You? Oh, you did, okay.
I said it was made of sugar lactic. Some galactic acid. Galactic. Yeah.
Way to get him to get it out. Thanks. You started this.
You'd have to be really good at handwork.
Yeah. Yes, we are.
Not
Don't touch it. How many people?
21.
Oh, wow, we went up.
We were up to, I think, 25.
Okay.
It is time to order pizza now. It's 12:30. We're actually, you know, put it on, like, put it in order. That's on it.
Yeah.
I enjoyed it.
It's not sterile.
Did you want to see it?
Oh.
It's your baby.
Make sure you have some volume.
Fine job.
The skin is, wow, you really made a small,
You know, we have plenty of disposable gloves.
well,
Don't want you to have a huge scar because it's right on your neck, and then everybody's gonna ask who did that.
this is your calling card.
These look a lot thicker than the
Nylon. Is that what these really look
This is-
thicker?
Okay.
That is what? Yeah. See? And all of a sudden,
All right, so this next stitch, I'll kind of walk you guys through here what I'm doing. Stitching is actually really fun.
Monotonous.
It's monotonous, but I really enjoy stitching. That was one of the things I'd always volunteer. Hey, this guy's got a gash on his head. Ooh, pick me. So,
Do you like to sew?
I do like to sew. Actually, if I have a hole in my socks or something, my wife makes me sew. So this is that deep one. So I'm putting it in deep, and you'll see that I want to bury the stitch so the stitch doesn't pop out later in life, or later down the road. It will eventually completely resorb. So I go in low and then come out high.
Tell them about that woman suit that you're sewing together.
That sounds like a pickup line. I go in low.
So what happens to the deep sutures? I know you said they're absorbable, but
Yep.
do you just leave them in there and?
Yeah. They just stay in there.
the skin will just grow together, together and then just absorb.
So if I were to do this with the nylon, the skin really does not like things that are not its own or not absorbable. So eventually it would say, this sucks, and spit it out. So that's
a
why
lot of inflammation.
with a lot of inflammation. I actually had, I think it was a patient of yours who had a spinal surgery done, came to see me and said, hey, I got this weird thing in my back. 3 years later, and it was a stitch that I pulled out, and it was about 6 inches long. Kind of cool, but
Just a heads up, we got about 7 minutes before we go to lunch, which is fine. You know,
finishing up.
and if you guys need to go, just go right ahead and go. If you want to stay and watch the finishing up, you are.
Sorry.
You have an hour lunch today. We do have
So
lunch.
you guys are going to lunch right after this?
Yes, perfect segue.
Good timing.
So I do instrument ties. It's just what I like to when it's just faster.
Even though the surgeons look down on us.
They do. They don't like instruments. Because they're purists, meaning they like to use their hands to do stuff. So they'll do. There's actually a proper way to tie it up. And surgeons, if you've ever worked with a good surgeon, some of them can do a one-handed tie, which is actually pretty cool. So they'll hold the one piece of the suture with one hand, and then with the other hand just like 5 knots in like, I don't know, how fast have you seen anybody do that? Mark, have you ever?
Oh, they're pretty quick.
They do it quick. So now you guys can see that it's kind of closed up there, so I'm just going to throw in some
Sorry, Lisa.
skin stitches and we'll be done. Skin, nylon.
So how long before?
Come out.
before he has to have the external?
So we want long enough to, what?
The Empire.
Empire City Ray?
Empire
Yes,
Records.
he says, great job, both of you, and Doc, feel better soon.
Thank you, Empire City
Thank
Ray.
you, Empire City Ray.
Lunch break over.
He's in New York.
Yeah, he's probably.
So 7 to 10 days. The neck actually heals up a little quicker, so probably closer to that 7 mark.
Yeah.
Is when we'll take these out. And at that point, it'll have about 50 to 70%, I think, of its normal strength of the closure, and then that gets to normal over the next month or so.
About 5 days for the hand or the face.
Yeah, they heal.
2 weeks for like the elbow or the knee.
Whatever.
There's lots of
Great. Your arm will get really tired though pretty soon.
Or should I put the
You are fine.
So are you starting from the middle?
I do start from the middle.
biceps.
Why do you think I do that? That's a good question. Why did I start from the middle? What's that doctor doing?
Oh, yeah, I get it. Okay.
So if you start from one end, sometimes you can get ahead of yourself, and then you come to the other end, and you have this nice, ugly dog ear that leaves a huge scar. So if you start in the middle and work your way out, you're going to make sure that both sides are going to come down nicely. You need a dog ear. You cat person.
That's
You're gonna water it, you know what?
You've got some tough skin. Doesn't
Well,
it?
that's because we didn't sharpen the suture.
Any more questions from anyone?
No, everybody's speechless.
Speechless.
They're just
We
watching.
left them in awe and wonder.
Tell them if they don't already follow, they can swipe right
I
to
got
follow.
you.
Swipe right to follow.
Swipe right to follow.
Because some of them may find they can't comment on it because they don't follow.
Oh.
And then I have to follow them back.
Well, yeah. Just thinking.
One more stitch, maybe.
As long as it doesn't get caught on things. Clothes. Cat claw, Larry will call it. Those things.
We did.
How many knots do you do to make sure it's really?
Depends on the type of suture.
Yep. You did. Nylon's not as slippery, so you don't need as many knots.
And the sutures come in different gauges. So a big fat one, you want to put fewer than you would put in a fine little tight one. So like the type that we would use on the face, a real thin suture, you put in maybe 5 knots, whereas a real fat one you use on the back, you maybe only put in 3 knots.
Because I saw someone with her nose stitched up, Steve Becker, and she did like 10 knots, it was so many
Yeah.
knots.
Yeah, you want to do more for the face with
I'll
very
usually
fine
do 4 to
suture.
5. Just for insurance, that's how many I'll do.
Did you say how many stitches you're gonna have on this meeting?
That's 5. But 3.
3. Oh, just 3.
Do you want more?
No.
It's Halloween coming up.
I might keep them in until then.
I need a match.
Can I have some Vicodin, doctor?
All right. I think we're set. So,
Yay.
do we have the, really quick before you guys go, I'll show you what the stuff that's inside.
Oh, yeah. Get that close up on here.
Wow. We can get you all set up. You actually, you can.
I can have you hold it. Just like
Yeah, you get. So there it is. I'm gonna, let's just slice it in half and see what's inside.
Great idea.
It won't squirt. We shall indeed.
So, at the top where I kind of took a little off, it's actually, you can see it's kind of hard to cut into that, which is a good thing because it's actually hard to open up. Dissect it here.
A little mold ball.
Just read the line original words. So there it is. It's kind of cheesy. There it is. So if we take it out of the counter, everybody can smell it.
Oh my goodness.
I did not.
Okay.
It's been there for a while.
Yeah, it is.
And how's our patient?
Thank you.
Thank you so much.
Wait, let's get back. Here it comes, recovery patients.
Yeah.
Once again, I can't thank you guys enough for taking the time out to be here. It was absolutely fabulous. Have a great weekend, everybody. Thank you so much, and you too.
Thank you.
Oh,
Fair River.
Thank you, guys.
Thanks for everybody for being a part of our.
Nicely done. That was good.
We're gonna sign off for now, and we'll put this up on the Auburn Medical Group YouTube. So if you have friends who want to see it, they'll be able to find it. Auburn Medical Group YouTube. And swipe right to follow if you don't already. Thanks a lot for being a part of things. We're glad